As I have told earlier, what are the differences between apoptosis and necrosis, right? And now we are going to discuss about another important topic, which is apoptosis, right? So, what is apoptosis? If examiner asks you, what do you mean by apoptosis? So, we have to understand that apoptosis is a Greek terminology which means apoptosis, right? Which means falling off. So, when examiner says what is the meaning of apoptosis, so it means falling off of a cell. So that is the literal meaning of the apoptosis. That is very important to understand. What is the meaning of apoptosis? Apoptosis. See, this is the apoptosis. Tosis means falling off. So falling off of the cell from the tissue is called as apoptosis. So that is the literal meaning of apoptosis in Greek, right? Why I am emphasizing on this point, what should be the meaning, you have to understand, because there is another important question which examiner asks you, what is apoptosis? Apoptosis is a programmed cell death, right? Programmed cell death. So apoptosis is not programmed cell death only, right? What I mean to say that programmed cell death word is not only used for apoptosis, right? It's a vague terminology. So it's not the meaning, it's a conceptual understanding of the apoptosis, because enzymes are programmed after the cell death for the degradation. So that is why it is called as programmed cell death. But there are many other things which are considered as programmed cell death. So here I would like to tell you, this point is very important. What are the other things apart from apoptosis? See, as I said, apoptosis is a programmed cell death. So what are other things which are programmed cell death? Apoptosis is a programmed cell death. Necroptosis is a programmed cell death. Necroptosis is a programmed cell death. Pyroptosis is a programmed cell death. And another important thing which we should consider in our mind, because whenever you are going to write a PGI exam or AIMS exam, examiner may keep this kind of question. What about neutrophilic extracellular trap? Neutrophilic extracellular trap, NET. Neutrophilic extracellular trap. Neutrophilic extracellular trap. That is the full form of NET, right? So that is the full form of NET, neutrophilic extracellular trap. So neutrophilic extracellular trap is also an example of programmed cell death. So that is why I was telling programmed cell death is a vague terminology which is applicable to apoptosis, necroptosis, pyroptosis and NET, all of them, right? Why I wanted to emphasize on this point, because in All India exam there was a question regarding apoptosis, which of the following is a true statement? Whether you would like to tell it as a energy dependent process, or would you like to call them as a programmed cell death, as we have discussed just now, programmed cell death, right? So these are the two things which examiner had asked, right? And we all know that for the apoptosis, most important organelle is mitochondria, right? That was All India question. Remember this point? Most important organelle for apoptosis is mitochondria. And when mitochondria is involved, ATP will be released. So energy will be released. So this energy dependent process would be preferable answer over the programmed cell death. And this was the question in All India exam 2014 and 15, right? So 2014 and 15, this was the question. So preferably energy dependent process should be better answer. And this was again twisted in All India exam 2015. They had given active process. So apoptosis is an active process or energy dependent process, because most important organelle in apoptosis is mitochondria. Since mitochondria is involved, so they will be utilizing ATP, and that is why it is preferably called as energy dependent or active process. So this is better or more specific than programmed cell death, right? If you remember, when we were comparing between necrosis and apoptosis, that time I told you that necrosis is always pathological and apoptosis is both pathological and physiological. So same thing we are going to discuss here when we are talking about nature of apoptosis. How is apoptosis? Is it a physiological or pathological? So that time we will say that apoptosis is physiologic also, and apoptosis can be pathologic also. So it is both physiologic and pathologic, right? So it is both physiologic and pathologic. What are the examples of the physiologic and pathologic apoptosis, right? So what are the examples? Physiologic apoptosis first we will see, and overall we should understand that this physiologic nature of apoptosis is the most common pattern of apoptosis we see in human body. So physiologic apoptosis is more common than pathological apoptosis, right? Physiological apoptosis, what are the examples? So example number 1, during organogenesis, organogenesis or embryogenesis, right? So during embryogenesis, when there is an organ development going on, to maintain the symmetry of the organ, excessive amount of the tissue will be removed by apoptosis. That is the one of the very important physiological apoptosis example during embryogenesis or organogenesis. Similarly, there was a question in AIMS exam, and that time they had mentioned one terminology that is called neovascularization. So this point we must remember, neovascularization means new blood vessel formation. New blood vessel formation, just I am giving you an example. Suppose this is the new blood vessel formation going on, right? And there is some excess amount of capillaries here, here and here which is hanging, right? So this excess amount of capillaries which are hanging here, it should be removed by apoptosis. So this much area will be removed by apoptosis to maintain the symmetricity of this blood vessel or maintaining the uniform architecture of the blood vessel. So neovascularization is also example of physiological apoptosis, right? This is number 1 example. Number 2 and more important example of the physiologic apoptosis is killing of inflammatory cells. Killing of inflammatory cells. Killing of inflammatory cells after completion of their function, or you can say after completing their function, right? So after completing their function. So once inflammatory cells will finish off their functions, they need to be destroyed, and that destruction will be performed by physiological apoptosis. Physiological apoptosis. See, what I want to say, I wanted to explain you with some important concept. First thing, what are the inflammatory cells we know? What are the inflammatory cells we know? So I'm just giving you one example of the, say, a neutrophil, right? I'm taking example of the neutrophil. So as I said, killing of the inflammatory cells after completion of their function. So just take one example. This is the blood vessel, right? This is the blood vessel, and this is the bacteria. This is the bacteria sitting outside, extravascular areas, and this is the neutrophil which was going through the blood vessel. Because of this bacterial entry, now neutrophil will come outside to kill this bacteria, right? So neutrophil has come outside. So now neutrophil is here. Now neutrophil has arrived here for killing of this bacteria. So this bacteria has been killed. Now the question is, what is the fate of this neutrophil after killing this bacteria? It has killed this bacteria. So what is the fate of this neutrophil? So fate of this neutrophil, this will undergo apoptosis, physiological apoptosis. So this is how physiological apoptosis will happen. So now you can see that how you can correlate the concept to understand any pathology or to understand the medicine. So now you can see that when this neutrophil is moving towards the bacteria, what is this called as? Chemotaxis, right? This is called chemotaxis. So examiner asks one question, and see this beautiful concept of physiological apoptosis, explain that concept. Concept is this chemotaxis is unilateral or bilateral. See what I am writing here, it's a chemotaxis, and that was the older AIMS and All India question. That was the older AIMS and All India question. Question is, chemotaxis is unilateral or bilateral? See, when they will come out, they will never go back into the lumen because they will be killed by physiological apoptosis. So it's very obvious that chemotaxis is always unidirectional, right? So this is how we can correlate things together once we understand the concept properly. So physiological apoptosis will kill the inflammatory cells after completion of their function, and that is why chemotaxis is unidirectional. That is why chemotaxis is unidirectional, and that was the answer in exam, right? So that was the answer in exam, right? Unidirectional, right? So that was the answer in exam. Chemotaxis is unidirectional, right? So chemotaxis is unidirectional, right? So that is the important point we have to keep in mind, that chemotaxis is a unidirectional. So this is the second physiological apoptosis example. Third, another concept which we have to understand. Third example of the physiological apoptosis, elimination of autoreactive cells. Elimination of autoreactive cells. So autoreactive cells, what do you mean by autoreactive cells? These are those cells which can cause autoimmunity, right? These are those cells which can cause autoimmune disorders, right? So elimination of autoreactive cell, what they will do? Once these autoreactive cells have been removed, there will be no autoimmunity, right? So that is very important to understand. In our human body, in normal human body, there are certain amount of autoreactive cells which are formed, right? In bone marrow also, in thymus also, and in our peripheral blood also. So remember, in bone marrow, thymus, peripheral blood. Bone marrow, thymus, peripheral blood, everywhere autoreactive cells are formed, which can cause autoimmune disorder. But why a normal person is not getting autoimmune disorder? Because autoreactive cells are getting eliminated by physiological apoptosis. So we can say that physiological apoptosis is a mechanism to prevent autoimmunity. So this is how it prevents autoimmunity, or it protects us from autoimmune disorders. So that is important point to understand, which we'll discuss in immunology chapter also. So what I want to emphasize here, one point, that apoptosis is very important to prevent autoimmunity. What I said, physiological apoptosis is very important to prevent autoimmunity because they will remove autoreactive cells from the normal human body. And when autoreactive cells are surviving because of defect in physiological apoptosis, remember, whenever there is a defect in physiological apoptosis, we are prone to contract autoimmune disorders, right? So these are the three important points which I wanted to emphasize regarding apoptosis, right? Organogenesis, embryogenesis, neovascularization, killing of inflammatory cells after completion of their function. That is why chemotaxis was unidirectional. And third one is the elimination of the autoreactive cells to prevent autoimmunity, right? So these are the three important physiological examples, right? Now we are going to see what are the pathologic examples of the apoptosis, right? So pathologic examples of the apoptosis, number one, whenever we give chemotherapy or radiotherapy to a cell. So chemotherapy or radiotherapy to a cell will induce both apoptosis and necrosis. That was question in All India and AIMS exam. So when examiner is saying when a chemotherapy is given to a cell, that was the question. When a chemotherapy is given to a cell, what you are going to expect in that cell? So apoptosis and necrosis both will be seen, and that was the right answer. So both apoptosis and necrosis will be seen. So whenever chemotherapy or radiotherapy is given, both apoptosis and necrosis will be seen in this kind of cells, right? So that is the one example of chemotherapy and radiotherapy. Another example of physiological apoptosis well, sorry, pathological apoptosis, not physiological. Pathological apoptosis we will see in case of glucocorticoid. Glucocorticoid, it was 3 times question in AIMS 2013 and 2014. So 2 years consecutively they had asked question, okay, which of the following will induce apoptosis? So glucocorticoid is a drug which will induce apoptosis. That is why it is given in autoimmune disorder, because they will kill autoreactive cells and they will prevent autoimmunity. Right? So glucocorticoid will prevent autoimmunity, and that was the AIMS question in 2013 and 14. So keep that in mind. Glucocorticoid will induce apoptosis. So that was the question in AIMS exam, right? So glucocorticoid will induce apoptosis. This is the second example. Third example of the pathologic apoptosis will be graft versus host disease. Graft versus host disease. So graft versus host disease is also one example of the pathology. Another great example which examiner had asked in exam, was viral hepatitis. There will be release of councilman bodies. This was the all India question. Many times this question has been repeated. Councilman bodies, I'll just tell you, question examiner usually asks, councilman bodies are seen in which hepatitis? Alcoholic or viral? So your answer will be, it is seen in viral hepatitis, right? So these are seen in viral hepatitis. So what is councilman bodies? Councilman bodies are actually apoptotic bodies. So always remember this point also. What are the councilman bodies? Councilman bodies are apoptotic bodies, right? So these are apoptotic bodies which are present in viral hepatitis. So councilman bodies are example of the apoptotic bodies which is seen in viral hepatitis. Another example of the pathological apoptosis which we should keep in mind is the misfolding of the protein, right? So whenever there is a misfolding of the protein is happening, this can also induce apoptosis, right? So misfolding of protein can also induce apoptosis, and we will discuss later on how misfolding protein disorders are associated with apoptosis, right? So these are the comparison between the physiologic and pathologic apoptosis, right? So now we can see physiologic and pathologic apoptosis. Physiologic apoptosis is more common, and these are the example. Pathologic apoptosis, these are the examples which we have to keep in mind, right? So now we are going to see the microscopy of the apoptosis. What are the morphological changes we are going to see in apoptosis? So what is the morphology we are going to see in any apoptosis, right? So as we have discussed in reversible injury, earliest cellular sign of cell injury is the cell swelling, except for the apoptosis. So whenever there is a apoptosis, first thing you will notice cell shrinkage, right? So cell will shrink, and that is the first sign in apoptosis, right? So that is what we have learned. This was exception to the cell injury sign. First sign, cell swelling in all other type of cell injuries, but in case of apoptosis, cell shrinkage will be the first sign, right? So which I have written, cell shrinkage, right? Another important thing which examiner asks in exam, what is the most characteristic feature of the apoptosis? See, most characteristic, many times in All India and AIMS exam, most characteristic feature of apoptosis is the chromatin condensation. Remember, it is chromatin condensation. So chromatin condensation is the most characteristic feature of apoptosis on microscopy or on morphological examination. This chromatin condensation had been asked many times in All India exam and AIMS exam. So this is what I wanted to highlight. This is the most characteristic, right? But there was a question in All India exam 2014. There was a question in All India exam 2014. Which of the following is most characteristic? Chromatin condensation was not given. Chromatin condensation was not given, and they had given cell membrane is intact. Cell membrane is intact. So that was the right answer, because chromatin condensation was not given. So just keep that in mind. If chromatin condensation would have been mentioned, it would have been a better answer, right? So that was the all India question. Cell membrane intact is the right answer, right? Cell membrane intact is the right answer, because cell membrane is intact, right? So now you can see that because cell membrane is intact, so that is why there will be no inflammation. So that is why there will be no inflammation seen in apoptosis. That was the AIMS question in 2014, right? So there will be no inflammation. So that was the question in AIMS exam. No inflammation will be seen in apoptosis because cell membrane is intact, right? Another key feature which you will notice in case of apoptosis, when you will see the cell, when you will see cell, you will find the cytoplasm of cell will be more eosinophilic, hyper eosinophilic cytoplasm, hyper eosinophilic cytoplasm. So cytoplasm will be hyper eosinophilic, and here I want to show you this chromatin condensation is present, right? So chromatin condensation and hyper eosinophilic cytoplasm, this is another important feature which you will see in case of apoptotic cell. But this hypereosinophilia is not very specific. This can be seen in necrosis also. So just I am telling for the understanding of some basic point which we should know, so that some of the images which we will discuss sometime later we can understand, right? Fifth important point which I want to tell you here, in normal cell, see what I want to show you a normal cell. In normal cell, what you will observe that there is a phosphatidylserine lipid receptor which will be on membrane, and they will be inside the cytoplasm. They will be facing towards the cytoplasm. So here I wanted to show that phosphatidylserine receptors. So these are the phosphatidylserine receptors which are facing inwards, means toward the cytoplasm. What are these things? Phosphatidylserine receptors. Phosphatidylserine lipid receptors, right? So these are phosphatidylserine receptors. Normal cell, they are facing inwards, right? Means toward the cytoplasm. So that is important. So normal cell, they are facing inwards or towards the cytoplasm. But during apoptosis induction, so listen to my language. What I'm saying, when apoptosis is getting induced, right? When apoptosis is getting induced, then this phosphatidylserine receptor will flip outside, right? So now they are flipping outside. So phosphatidylserine receptor, when they flip outside, it means this cell is about to have apoptosis, or in other words, marker of apoptosis. This flipping outside of the phosphatidylserine receptor is a marker of apoptosis. But the question is, how we will know? How we will know that this has been flipped outside? So this can be detected by one lipid stain or lipid dye. So we will apply one lipid dye. This is the lipid dye, because phosphatidylserine receptor, what is this? This is a lipid receptor, right? So to identify this lipid receptor, we will use one lipid dye which is called as annexin V. So annexin V will be used. So annexin V is a lipid dye. Remember, this was the question in one state exam. Okay, what is annexin V? Annexin V is lipid dye. That is why I wanted to explain like this. Okay, phosphatidylserine receptor is a lipid and annexin V is a lipid stain. That is why it is also called as stain for lipid. And this was, annexin V was the all India question also, right? Okay, what is marker of apoptosis? Marker of apoptosis. So what is marker of apoptosis? Answer was annexin V is a marker of apoptosis. So that was the question. That was the beautiful question in all India exam. Okay, what is the marker of apoptosis? So just remember, marker of apoptosis is annexin V. So that was the all India and AIMS question. So annexin V is a marker of apoptosis. That was the all India question, right? So in simple words, we can say like that, कि phosphatidylserine receptor is a eat me signal. He is inviting, please eat me. Who will eat? A phagocytic cell. right? So eat me signal is the marker of apoptosis which you detect by annexin V. This is the fifth point. Sixth point, as I told you, in apoptosis cell membrane will be intact, but there will be a bleb formation because of the cytoskeletal deformity, right? So because of the cytoskeletal deformity, there will be a small protrusion which is called as bleb. So this is how bleb will be formed. So in exam they ask this question, bleb formation will be seen in apoptosis, right? So bleb has been formed and this bleb will detach in toto. So now this bleb will detach in toto, right? So as a complete thing, they will be detached from the parent cell and they will be removed like this, right? So once they have been removed like this will be called as, this membrane bound structure is known as apoptotic bodies. Apoptotic bodies. So apoptotic bodies are also very important MCQ in exam. What are the apoptotic bodies, or what is apoptotic bodies? Many times in All India exam. So what is apoptotic bodies? Now you can see it's a membrane bound structure. So what is apoptotic bodies? So when examiner asks this question, your answer will be, it's a membrane bound structure. Membrane bound structure. So membrane bound structure. But in All India exam they had given one option. Will they have organelle? Membrane bound structure, or they will have organelle also. So what we need to remember, yes, they will have membrane bound structure plus organelle. So that was the answer. Apoptotic bodies are made up of membrane bound structure plus organelle, right? Membrane bound structure plus organelle. So just for understanding point of view, I am just making one mitochondria here, organelle. So that we can understand what are the apoptotic bodies, membrane bound structure plus organelle. But maybe in future they may ask question, what is the precise definition of the apoptotic bodies? So precise definition of apoptotic bodies says that they are membrane bound structure plus organelle and they may or may not have nuclear remnant. May or may not. So plus minus, see what I am writing, plus minus nuclear remnant, plus minus nuclear remnant, right? So membrane bound structure plus organelle plus minus nuclear remnant. So these are the three components of the apoptotic bodies, right? So this is the point we have to keep in mind, membrane bound structure, organelle plus nuclear remnant. So as I already told you, these two options had been mentioned in All India exam, but this can be your future question, nuclear remnants, right? Now, what is example of apoptotic bodies? What is example of apoptotic bodies? As I have discussed already, in viral hepatitis, you will see Councilman bodies. So Councilman bodies are example of apoptotic bodies, right? For example, how you will identify, why I wanted to emphasize this Councilman bodies, because in your exam, when examiner will ask you this question, right, how to identify Councilman bodies, so it will not be that easy question. So how examiner will be asking question like this? Question will be, in a case of viral hepatitis. So what I am showing you here, it's a case of viral hepatitis. In this viral hepatitis, liver biopsy was performed. So this is the liver biopsy. An examiner will ask you, identify this structure. What is this structure? So that time, don't forget rule of 5, observation and comparison. So first you look at the 5 areas, all corners and the center. Center, he has been asked this question, what is this structure? So now you start observing and comparing this liver tissue. If you compare this cell with this surrounding cell, this is the normal cell, right? This is the normal hepatocyte. Normal hepatocyte, look at the cytoplasm and compare the cytoplasm at this place. So how is the cytoplasm? More eosinophilic or less eosinophilic? More eosinophilic, right? So first thing you are seeing that there is a hypereosinophilic cytoplasm. Hypereosinophilic cytoplasm, this is number one. Second thing, you look at the nucleus here and you look at the nucleus here. What is the difference you are appreciating? Can you notice this nucleus is little faded, means it's a granular. I should not say faded, it's a granular chromatin, normal nucleus. But what about this one? This nucleus is more blue, hyperchromatic, because chromatin has been condensed. Chromatin has been condensed. So there is a nuclear chromatin condensation. Nuclear chromatin condensation, if you remember, when I was telling you what is the most characteristic feature of apoptosis, it is chromatin condensation. So hypereosinophilic cytoplasm, nuclear chromatin condensation, membrane bound structure. So what do you feel? It's a viral hepatitis case. It's a councilman body. So that is how we will come to a conclusion that we are looking at the councilman bodies. This is how we will identify councilman bodies on light microscopic examination. So it's a viral hepatitis. Councilman bodies will be hypereosinophilic cytoplasm and nuclear chromatin condensation will be present. Right. Now the question comes to our mind, when cytoplasm, cell membrane is intact, right? That is what we have learned. That is what we have learned. Cell membrane will be intact, right? Cell membrane will be intact, and that is why there is no inflammation. So question comes to our mind, then how this cell will be removed? How this cell will be removed by apoptosis from our dead tissues? How? How they will be removed? So now we will see. This is the procedure of removal of the apoptotic bodies. So one by one, apoptotic bodies will separate. They will detach from the parent cell, and the last step of phagocytosis will happen. So now I am going to explain you the last step, seventh one, right? What happens? As I said, bleb formation, and this is how they will be forming numerous blebs, and all these blebs will be converted into apoptotic bodies, right? So all these are apoptotic bodies, and as I have told you, apoptosis, when they are induced, there will be presence of phosphatidylserine receptors. So these are phosphatidylserine receptors. In this apoptotic bodies, phosphatidylserine receptor will flip outside, and this phosphatidylserine receptors will be identified by a phagocytic cells, say macrophage. So these are the phagocytic cells, say macrophage. So phagocytic cells will be having their own scavenger receptors. So these are scavenger receptors present on phagocytic cells. Scavenger receptors. So through the scavenger receptors, they will be eating up all this apoptotic body, right? So what is the last event, or what is the end outcome of apoptosis? That was the DNB question. What is the end outcome of the apoptosis, right? So answer will be, what is the end outcome? Bleb formation or phagocytosis? So answer is, yes, answer is phagocytosis. Answer is phagocytosis is the end outcome of the apoptosis. So that was the question, right? So that was the question in DNB exam, and answer will be phagocytosis. Answer will be phagocytosis, and this is how it will happen. And throughout this process, there will be no opportunity for inflammatory cells to involve. So this is how a morphology of apoptotic cell will be visible. What we need to understand here, chromatin condensation is most characteristic, and that is why when I will explain you the mechanism of apoptosis, every time I will be telling you, see, apoptosis is done because this is a chromatin condensation. Chromatin has been condensed, so this is apoptosis. That is why examiner asks, chromatin condensation is the most characteristic feature of apoptosis on microscopic examination.